Welcome to this presentation on Internet of Healthcare Law, Privacy and Data Protection Aspects in an Internet of Everything. My name is Rihad Rak, doctoral candidate in Law, Science and Technology, and I'd like to share an overview of my research project and its main findings. About the context, COVID-19 pandemic has triggered a remarkable leap of innovation in healthcare and has induced the uptake of digital health solutions and telehealth services. These can act as a force multiplier for health systems by broadening the delivery of healthcare outside the clinical context. They can also enable intelligent connection of things, people, data, and processes in healthcare, what we can refer to as an Internet of Healthcare. They can also support an integrated transition between virtual and in-person healthcare services. They can also enable remote monitoring of patients outside the clinical settings and timely diagnosis and prompt treatments. Overall, they can support the smart transformation of healthcare, underpinned by data-driven, person-centered, and real-time response solutions and prospective insights. However, the realization of these benefits are currently hindered by legal barriers, regulatory shortcomings, and privacy and data protection risks. In the first part of my research project, I looked at how new enabling technologies and their integration in telehealth can facilitate the transformation of healthcare into an Internet of Healthcare. Internet of Healthcare is underpinned by the use of Internet of Health Things devices. These are enabled by embodied computing, so the use of sensors with internet connection. They have various types. Wearables such as a smartwatch which can detect whether the patient has COVID or not. An implantable smart bionic arm also. An embeddable smart tattoo which can show in real time the blood sugar level of a patient. Or an ingestible smart pill which can revolutionize the detection of digestive problems. And also there are non-invasive methods, such as a smart health mirror to detect skin problems. Internet of Health Things devices as sensors can collect large amounts of raw data. And these raw data, in combination with data obtained from other sources, can form a large big data sets. However, in order to transform these into actionable smart data, one needs to use data science methods, and in particular AI systems. Actionable smart data can improve healthcare services by increasing medical intelligence, which can lead to better decisions affecting the health of individuals. In the second part of my research project, I looked at how Internet of Health Things hardware devices and interconnected software, and in particular AI systems, are currently regulated under EU law. In terms of their legal qualification, first one has to look whether these Internet of Health Things hardware devices and connected AI system software are intended to be used alone or in combination with each other for a defined medical purpose. Depending on this, they have to be qualified individually or separate or in combination. And in terms of the safety, performance, and quality requirements, if a device falls under the definition of medical device under the medical devices regulation, then those higher, stricter safety, performance, and quality requirements will be applicable. However, if a device is considered only as a consumer health product, so it is not intended to be used for a medical purpose by its manufacturer, then only the General Product Safety Directive's safety, performance, and quality requirements will be applicable. Similarly, in the case of software products, if the software product qualifies as an AI system under the Draft AI Act, then those stricter safety, performance, and quality requirements will be applicable. The General Product Safety Directive functions as a safety net. However, currently it is not clear whether it would always cover all consumer wellness applications, and also this directive is currently under revision and in the general product safety regulation proposal, it's still not clear whether, for instance, software would fall under the definition of product. So these lead to legal uncertainties in terms of the safety, performance, and quality requirements, and therefore the legal qualification of these Internet of Health Things devices and connected AI systems. And based on this legal qualification, there are numerous legal consequences. For instance, a medical device will have a unique identifier which can be associated with a natural person, so it has data protection implications. A consumer health product will not have such an identifier. Also, a medical device is subject to stricter cybersecurity requirements under the medical devices regulation than a consumer health product. In terms of AI systems, if a software qualifies as an AI system, then the AI governance requirements in the Draft AI Act will be applicable. And also in terms of the reimbursability of certain digital health products, especially under national health legislative frameworks, for instance, in Germany or Belgium, if a device qualifies as a medical device, then it can be prescribed and will receive reimbursability from the health insurance system. In terms of the interplay between the Draft AI Act and the Medical Devices Regulation and Data Protection Law, what I have identified is that there are numerous reasons for legal uncertainties in case of AI-enabled medical devices. Firstly, there are misalignments and duplications between the Medical Devices Regulation and the AI Act in case of AI-enabled medical devices. So AI systems that are medical devices or AI systems that are intended to be used as safety components of medical devices. The two legal regimes prescribe different safety, performance, and quality requirements, which mean that manufacturers will have to duplicate their technical documentation. There are different definitions, for example, for user under the two regulations. Under the medical devices regulation, laypersons are also considered users, whereas under the AI Act, the user will typically be the healthcare provider. There are also different risk classification between the two legal frameworks. Medium risk medical AI-enabled medical device under the medical devices regulation will be considered typically a high risk AI system under the AI Act. There are also different notified bodies performing parallel conformity assessments, which is an inefficient use of resources. In terms of the interplay between the Draft AI Act and data protection law in this context, there is a lack of interplay between the two legal frameworks. First of all, there is the problem of allocating responsibilities because under the Draft AI Act, it is not clear whether the provider and the user, who will be the controller under the GDPR, because according to the European Data Protection Board and European Data Protection Supervisor's opinion in this regard, the controller would typically be the user under the AI Act. However, most of the compliance obligations defined by the Draft AI Act are linked with the provider. There's also a lack of alignment and flaws in terms of the risk-based approach between the two legislations. There are missing risk classes such as group privacy risks are not defined under the Draft AI Act, which is one of the shortcomings also of the GDPR. There are also different compliance mechanisms. There is a lack of connection between the certification mechanism, certification system, and the codes of conduct adopted under the Draft AI Act and the corresponding mechanisms under the GDPR. In terms of the third part of my research project, I looked at topical privacy and data protection challenges in telehealth. First of all, I looked at the peculiar privacy and data protection risks relating to IoT-enabled telehealth systems. And in connection with this, I found that it's important to distinguish between the right to privacy and the right to data protection. Um, in this regard, data protection can be considered a facet of privacy. They can be considered complementary rights, or they can be considered independent rights, depending on which legal framework, international European legal framework, we are using. And this has different implications. Then there is the issue of data categories, how we interpret data concerning health under the GDPR. And in relation to this, it's important to highlight the interpretation question between Article 4, Paragraph 15 and Recital 35 of the GDPR. In particular, what constitutes revealing information about one's health, what is to be considered quasi-health data in these contexts. Then, with new legislative instruments, we see that the legislator has defined on an EU level new types of data categories, which are all relevant but have different legal implications. For instance, the personal and non-personal data generated by products connected to the Internet of Things under the Data Act, or electronic communications data defined by the e-privacy regulation proposal, or personal and non-personal electronic health data defined by the European Health Data Space Regulation proposal. These are similar data categories, but they have different legal implications again, and it's not clear how these data categories interplay with each other. And finally, under this topic, there is the issue of how we analyze functional actors within an IoT-enabled telehealth ecosystem. We may reach different conclusions, legal conclusions, depending on whether we adopt a data protection based view according to the GDPR, or a data governance based view under the Data Governance Act or the Data Act, or whether we use an IoT service based view of functional actors according to international standards in this topic. The second case study that I've looked at considers the use of teleconsultation in telehealth. Teleconsultation was scaled during the pandemic due to the protection of doctors and patients. And in particular, I looked at how what kind of privacy and data protection issues may arise when a health professional is connected with a patient on a healthcare platform via its application server, and uh, and especially if they use a third-party video API, application programming interface, cloud service provider to create these video rooms where the teleconsultation is conducted. And in this regard, a fundamental challenge is to define who is the controller and who is the processor, who are the processors in this ecosystem, because these have implications, of course. And independent of whether the healthcare platform, for instance, is a controller or a processor, it can be regarded as a good practice that they should also perform a data protection impact assessment, regardless of whether Article 35 is applicable to them or not, considering that they connect the two clients in this call. And lastly, I've looked at the implications of the new European Health Data Space Regulation proposal for marketplace services and patient CRM services from data protection and data governance perspectives in terms of the product development, operational risks, and business opportunities. The main topics in my analysis have related to the implementation of the new rights enshrined in this regulation proposal, and also the access and sharing permissions for health professionals, and what kind of implications the technical specifications of electronic health record systems and its data categories and exchange formats will have for these marketplace services and patient CRM service providers. And also, I've looked at how the secondary use purposes can be guaranteed as envisaged by the European Health Data Space proposal, and what kind of challenges these will uh, have, uh, these will imply for marketplace services and patient CRM services. In conclusion, based on my research, I've seen that there is a lack of interplay between legislation and legislative proposals regulating health related data and digital technologies. Much of these could be overcome in due time, as in the legislative phase, um, either by amending the legislative proposals, or otherwise by modifying the GDPR, for instance, in order to better interact with the AI Act, for instance, or the Data Governance Act. There are also flaws and shortcomings in regulating privacy and data protection aspects of new enabling technologies in healthcare, as I have shown. And all of this will increase compliance burdens for the industry, and at the end of the day, it could stifle digital health innovation. Thank you for your attention. If you would like to contact me and discuss this matter further, then I am happy to do so. Thank you.